Usually, keratoplasty is basically divided into penetrating keratoplasty and lamellar keratoplasty. So, in my earlier videos, the uh, penetrating keratoplasty has been explained, and the indications and other techniques and all these regarding the penetrating keratoplasty has been already explained. Now we are focusing on lamellar keratoplasties. Before we embark on lamellar keratoplasties, we will go into some details about the corneal structure. Cornea, actually, it's 1 millimeter thickness in the periphery. In the center, it's 0.5 millimeter, and it has got 8 layers. The innermost layer, which is in touch with the anterior chamber, is the endothelium. Genetically, this is derived from the mesenchymal epithelium. So, these endothelial cells, usually 7,000 cells per cubic millimeter at the time of birth of a human. With time, what happens is the cell loss is taking place and it doesn't have the regenerative capacity. So what happens is the loss is replaced by sliding and gliding movement of the existing endothelial cells. Now these endothelial cells are the one secreting the descending membrane, which is just anterior to the endothelial cells. The descending membrane is the one which is just anterior to the endothelium. Now, in front of the descending membrane is a stromal layer, which is basically 500 micrometer in thickness, and it has got some keratocytes and wandering cells, and all that cells are embedded in this stromal layer. These keratocytes are the one producing some hyaluronic acid and all these things, matrix collagen of this stromal layer. Now, with the condensation of the stromal layer, the Bowman's layer is produced that is just anterior to this stromal layer. Any reason due to some scarring or any other lesions taking place in this Bowman's layer will lead to corneal scarring, especially trauma and all other injuries, and the corneal transparency is affected by this occurrence. Now, in front of this Bowman's layer is the basement membrane, which is secreted by the epithelium, which is just in front of the basement membrane. And the epithelium is 3 layers in nature, and outermost one will have the microvillus. And just in front of this corneal epithelium, which is genetically derived from surface ectodermal epithelium, is a precorneal tear film. Now basically this is the structure of the cornea. Now we will talk about this lamellar keratoplasty. Lamellar keratoplasty, in contrast to the penetrating keratoplasty, portion of the tissue, corneal tissue, is removed and replaced by the donor tissue. Now anterior lamellar keratoplasty and posterior lamellar keratoplasty. There are 2 types. Posterior keratoplasty, they say deciment and endothelial lamellar keratoplasty. So that is other term for this posterior lamellar keratoplasty. Now, in case of this anterior lamellar keratoplasty, what happens is the epithelium just anterior outermost layer, and Bowman's membrane. And the descending membrane seated in between the corneal epithelium and the Bowman's membrane, and part of the stromal tissue are removed and replaced by the donor tissues. And the indication of this anterior lamellar keratoplasty, there are several indications are there. Say congenital condition like limbal dermoids, and any damage to the cornea, and deep-seated chronic pterygiums and connected lesions, and complicated with some surgeries of the pterygium, and acid burns. So these are the common indications for the anterior lamellar keratoplasty. Now, having said this one, we'll come to this descending endothelial lamellar keratoplasty, posterior lamellar keratoplasty. Indications of this one are basically the endothelial damages, and especially sometimes due to these surgeries like phacoemulsifications and all that, and sometimes due to the increased phaco powers and all that may damage the endothelium. So in that case also this surgery is needed. Other conditions like corneal endothelial dystrophies, Fuchs endothelial dystrophies, corneal gatatas, and those are the other conditions, other indications for this posterior lamellar keratoplasty. Now, during surgery, some phacoemulsification surgeries and all that, sometimes unexpectedly what happens is the descending membrane may be peeled off from the corneal structure. So that is also another indication for this posterior lamellar keratoplasty. Now, having said this one, all these conditions are involved with different techniques. So according to the indications that surgery is performed.